Welcome to Joy Wisdom Trust. I wanted to fill some of the gaps that society has misunderstanding about or underestimates the amount of emotional fallout and trauma for women from miscarriage. I must say that postnatal depression, post-traumatic stress disorders have grown enormously. So we're really not getting to the core of this, and many women are suffering with grief, sadness, and inconsolable because of the issues that they've gone through, continue to go through, and causing mental and physical health issues. Not a lot has changed in 12 years in supporting women. The ongoing health decline is evident, and the cost to society is billions, with firefighting. Ongoing disorder results are inevitable, and the apathetic attitude is strong in society. Humanity needs change to bring a bigger platform of understanding. What we don't seem to understand is emotional issues go hand in hand with mental health and mental health decline. Emotional issues will also cause physical health decline. If we don't deal with the emotions, it drives the other two, the decline, the internal decline, because again of peptides, chemicals, hormones, things will decline, and it does affect the DNA. It does affect our cells and how healthy we are or not. So underlying postnatal depression and PTSD can remain from miscarriage, IVF, and maternity. We only think of depression as happening postpartum after birth, and research shows many women experience the same symptoms during pregnancy. Again, official data is very poor. Mood disorders such as depression, anxiety can occur during pregnancy or within a year of delivery, now referred to as perinatal mood disorders. Postnatal depression can be a long-term disorder from months to years, and many physical and emotional changes occur while we are pregnant. And after we give birth, up to 20% of women report feeling anxiety, sadness, depression, panic, frustration, and feeling hopelessness. Obviously, previous mental health issues will be a factor, but we need to acknowledge that postnatal depression and PTSD is common in maternity scenarios. Intervention, shock, trauma are causes. And of course, you will have, again, the hormonal imbalances. The post-traumatic stress disorder tends to come from when women are feeling out of their depth in the delivery process, intervention. And as one woman told me, she felt as though she'd been raped because she said no to intervention, but they went ahead and did it anyway and broke her waters. She felt very aggrieved, and she had huge issues bonding with her baby. She said she liked her at 18 months, but she hadn't bonded with her. She didn't love her. These experiences are massive. The more we can prevent this, the more we will have happy children, because if you are not bonded with your parents, especially the mother, then you will feel depressed, rejected, abandoned, and causing ongoing mental health issues for us. And of course, it will grow as we grow into adulthood. Baby blues or postpartum blues affect 60 to 80% of all new mothers, often expressed as frequent and prolonging crying, anxiety, irritability, poor sleep, quick mood changes, and sense of vulnerability, thought to be self-limiting. I believe it is an overwhelmed, underwhelmed situation. Shock, trauma, and hopelessness feelings will come to the fore. It usually occurs in the first 3 days following birth and can continue for some women. Post-traumatic stress disorder following childbirth is usually triggered by trauma during the time leading up to, during delivery, or shortly afterwards. And the feeling either the mother's life or the life of her baby is at risk. But going through IVF processes will also create imbalances in the hormones, and they can be very extreme at situations. And having worked with women on IVF and failed IVFs, etc., they have been a truly anguishing situation for the mother, her ongoing health, has been affected drastically. Contrary to popular belief, pregnancy doesn't protect women from developing mood disorders, and up to 15% of women experience significant anxiety or depression in pregnancy. Common symptoms include overwhelming sadness, feeling of hopelessness, excessive worry, rumination, and feeling of being overwhelmed, extreme changes in appetite, sleep, and concentration. Paternal and maternal depression is known to have a negative impact on how parents interact with their children and can have a long-term consequence if untreated. Certainly, postnatal depression, I've found with working with women, they are given the label of postnatal depression, but unfortunately, I've found that they are just exhausted because they've worked well into their days of delivery when, of course, when you have a new baby, there isn't much sleep. They have gone into acute and chronic issues around exhaustion, diagnosed of postnatal depression. From my perspective, it has just been exhaustion. The levels of exhaustion that women will hold can be considerable. This came from a particular case of where I treated a woman with her second pregnancy. She'd had baby blues at the first one. The second one, she went into postnatal depression, which can happen. When I saw her, I treated her for postnatal depression, and that was full blown, and managed to turn her around. And the case study is in the pregnancy and birth book. She went on to have a third child, and again worked up until late in her pregnancy. Her third child was born. There was talk about coming to see me before she had the baby, but it didn't happen. And she went into what was diagnosed as postnatal depression. Eventually, I got to see her when I think about 4 months after her delivery. When I examined her, it's not the same at all as you had last time. Everything is different. Of course, I had her notes, etc., so I could compare. That was a relief to her that she was exhausted, and it made a lot of sense to her. She could put things in place. Her family could support her. She had good supporting family and husband. It's very, very different from first child to 3. When you have your first child, you can have your rest and take a nap when baby's having a nap, etc. When you've got other children to look after, 2 and 3, you haven't got that luxury. It can be really, really challenging for women. They do become exhausted, and quite a lot of women are exhausted before they go into labor. Underlying depression and anxiety can be transferred to our infant from fetal origins, from the womb, and living with underlying issues from the womb, even in adulthood. We then live it as normal when abnormal, and the depression or anxiety can be inherited. Obviously, we can create more of the same in life and live the status quo. If we can help women and support women and reduce the distress, maternity, and from abuse, we are going to have healthier and happier children. So we're going to be slowing down the issues that children are living with, and certainly depression that can come from the womb. It's if a woman is depressed in pregnancy, then her child is going to be formed from that. And we really need to take that on board by helping to reduce the depression of the woman, supporting the women in pregnancy, miscarriage, etc., or from abuse. Then we have a better chance of helping children. Unfortunately, we have a very apathetic view on this. We need to take it more seriously because it's costing us billions and trillions each year. If we put a stop to it, there would be lots and lots of benefits financially as well as health-wise. Share your stories. Please contact for more information. I thank you for your time.